You are going to want to leave your pediatrician after this episode. I am constantly amazed by the doctors, the nurse practitioners, the providers I meet on this podcast. And today's guest is no exception. In fact, she's an exception in how exceptional she is, because I actually made an appointment to see her after our talk. She was a pediatrician, began her journey at UCLA studying microbiology and molecular genetics, later specialized in pediatrics. And wait till you hear what she discovered when she became a pediatrician. And she realized this was no way to heal anyone. And you will also hear her why story, what made her turn her back on conventional medicine. And now, for over 10 years, she's been using holistic methods like craniosacral therapy, homeopathy, herbs, and nutrition to address the root cause of illness, empowering patients to heal by reconnecting with their body's innate wisdom. And she doesn't just take care of the peds, she also takes care of their families, because how can a child heal if their parents are not healed? Get ready for another powerful episode of The Medical Disruptor. Let's meet Dr. Sharak. Dr. Sharak, I am so excited that you are here with me. I really thank you for your time.
Thank you for having me.
Of course. As you know, the name of this podcast is Medical Disruptor, and I have had the privilege of meeting the most amazing medical disruptors all over the country. And I actually just had someone from a different country, so it's just exciting stuff. So I would love for you to tell our audience a little bit about what you did before you became a medical disruptor, and then what was the reason that you were like, nope, this is not enough.
Okay. I think I started in conventional medicine, right? Regular medical school, went into pediatrics. And when I went into peds, I thought I'm going to make this great difference with healing children and really helping them be as healthy as possible. And I quickly, and not so quickly in some ways, found out that I didn't really have the tools that I needed to be able to do that. I am a critical and creative thinker. I think kind of differently in general. I'm a right-brained type of person. Like the medical training that I had, that I really had 100% faith in. And I still remember the first day of medical school with that feeling of feeling like I'm going to be part of something really important and really great. And that, I think, brought a little bit of blindness to my training with me, because I still go, how do I stay asleep for so long? And that training was all about really becoming a really fancy pharmaceutical rep and being able to stop the symptoms of the illness. But when I would ask the question, why is this happening? Nobody knew the answer. And I realized pretty early on that our focus in conventional medicine was trying to figure out the diagnosis. 90% of our thinking was what is this? And then there was okay, and here's this pill that's going to take that symptom away. I also think that maybe that medicine worked well in the 1950s when our world was a little simpler and we weren't seeing the chronic disease epidemic that we had. Part of this was that I needed to evolve my medicine with what I was seeing in my practice. And I realized that pretty quickly because I was having a lot of children in my practice that had chronic things that just weren't going away. It's easy to talk yourself into giving antibiotics for an ear infection and it goes away and then you think you're fine. But then you start to see these same kids 10 times a year for ear infections and you're going, okay, something's not right. This child is not well. And so I was really thinking like that, and I was getting progressively more and more frustrated with feeling like I didn't know how to do it. And I'm a serious student. I feel like I'm maxed out my conventional training as much as I could. I was die hard, and I did really well in conventional medicine, testing and things like that.
Yeah.
So it's not like I wasn't a good doctor, is what I'm trying to say. It was just
because you're a great doctor.
I mean, I was trying to figure it out and realizing I did not know how to do that. But I had never had any connection to natural medicine in any way prior to this. So I was really in that community.
Did you have an aha moment where you were like, I can't do this anymore?
Yes. So my husband, when we were 35, he developed numbness in his right arm and chronic pain in his right arm. And pretty quickly we found ourselves at UCSF, MS, multiple sclerosis center, which is supposed to be the top in the country. And he had all kinds of testing. He had a very severe aggressive form of MS. And they predicted that he would be in a wheelchair in 5 years and probably dead within 10. So it was a
Wow.
very
That's a
intense.
that's a nice diagnosis to get.
Yeah,
Okay.
it was super intense. And we're meeting with these neurologists who are supposed to be the best in the country for treating this condition, but they've basically given him a death sentence. And they've said, here's the treatment we would provide, which was injections, immune suppressant medications. They were very expensive. I think it was like $12,000 a month, which wasn't the reason we didn't go that way. I mean, if it was really going to heal him, we would have done whatever it took. But when we looked at the data and really looked at the numbers, it was like, this is, if anything, just going to slow the progression. And I think when I asked the neurologist, my husband's vitamin D was really low. And I had read about vitamin D and autoimmunity. And when I asked the neurologist, like, hey,
He laughed, I'm sure.
yeah, he said, you can do that if you want, but
Sure,
like,
if you want
that
to.
doesn't matter.
Doesn't
And
matter.
then I said, what about nutrition? I also read
No.
like some people have like issues with food, and maybe this could be
No connection. Are you crazy?
no connection. The memory is very crisp because we literally walked out of that clinic, went down to this cute little spot to get some food, and my husband and I looked at each other and we were like, well, we're not going to do this. Like,
I love this.
We're going to just completely 180, and we never went back to that clinic. But the pressure was on because so I had all these experiences realizing the faultiness. And then I was listening to my parents and my moms who were teaching me about things through what they had learned. And this was pre-internet, really. I mean, there was some internet, but it wasn't really what it is.
Right.
So all of this communication was a lot slower and the learning was a lot slower. And I really had to kind of lean in on what resonated with me and what made sense. And to me, it didn't really make sense that suppressing the immune system is how you should treat an immune disorder. Like,
Right. It's so funny. You just said so many things. I want to take a moment to like appreciate everything that you said, because you said like a million things. And I really, some of them, I wrote down some gems. First of all, I love that you basically called yourself as a doctor, a fancy farm rep. And it's so interesting, right? Because it's not from a space. Sometimes the patients think that the doctors are in on it. Like, oh, we get these kickbacks or we don't.
No.
It's just like in school, this is how you're taught to manage disease. If I find a diagnosis, here's all the algorithms, right? And the algorithm has like one small line and it says modified lifestyle, like lifestyle modifications, like very small. And then immediately goes, and here are all the meds. And like you kind of like you're taught to like skip that line. Lifestyle modifications, yeah, whatever. Right. So you skip it. So I love that you said that. And I also love that you said the medications worked in the 1950s. The world was different in the 50s for so many reasons, but also just the amount of toxins that we are assaulted with all the time. So, and then you bring in, and I'll tell you in a moment, you asked me before we started this how I got into it, but it's anyone I talk to has either experienced something themselves or someone that they love. And for me, it was my wife. But before I get to that story, it's interesting that for MS and all autoimmunity, right? For MS and all autoimmunity, the idea of immunosuppressants are given. And of course it works. But never did we ask, but why is the immune system activated in the first place to attack to attack the body? Like, where's the why?
Exactly.
So we're just gonna put this big fire extinguisher all over all the immune system. Like, don't worry about fighting a cold or anything, but we're never gonna ask the why.
Yeah,
So,
exactly.
I mean,
and when you really look at the long-term health of those patients, they are not healthy. In fact,
no,
just the
of course not.
gateway to the next disease and the next condition. And so it's clearly the immune suppressants. I mean, I think sometimes pharma is just suppressing a symptom, and at the best, it's just preventing us from actually healing what's really happening. But sometimes the medication itself, suppressing the symptom, is actually causing the disease underneath to progress more rapidly. Because what we did discover with my husband was he had Lyme disease.
Oh, goodness.
He was celiac. There was so many pieces, and everybody's unique. We had mercury toxicity from his teeth, and we were living in a moldy house. And there were all these things that added up to this perfect storm. And then, of course, underneath all of that was a traumatized nervous system, which is the real big.
Oh my God, yeah. Oh, you said so many things. You said so many things. right? So for those listening, I was out to break it down because it's so like we can go into like this like back and forth, which is great. But I just wanted, so basically we have this human who got assaulted in every possible way that we know, right? The Lyme, the mold, celiac. So every single meal he's eating is like attacking. And so then we're surprised that we're going to develop MS, right? And then what we're going to do to treat it is just shut down, just suppress the whole immune system. Like it's so counterintuitive. That's crazy.
Which
I
then
just
just
want the
lights
audience to
up
really
the Lyme
appreciate that.
disease. I mean, it
And
just
then you can't,
allows
you can't
body-
fight the Lyme disease, right?
can't fight the microbiome issues. He can't clear the infections in his mouth from his amalgam toxicities. And we didn't do that. But when we suppress the immune system, we think everything's fine because they don't have any symptoms.
Sure. They feel
Right? It's
great.
like-
Best thing ever.
An infection, we're so trained that infection is you have a runny nose, you have a fever, you have a cough, you have these symptoms, but people don't realize that those symptoms are actually from the immune system's response to the organism, not from the organism itself. So when we suppress the immune system, we don't have any symptoms. That's true, but that doesn't mean we don't have an infection with organisms.
Love how you broke that down. Love how you broke that down. So important.
It's really important because I have a lot of patients who come to see me and they tell me, I never get sick. I've got 5 autoimmune diseases, but I never get sick. And I'm like, okay, we're going to talk about what does that mean you never get sick? And what it means is that when they get a virus, they don't have symptoms of that virus.
Correct.
But that's because their body is not responding appropriately. There's an apathetic immune response.
Yeah.
Which,
Oh my God, that is so funny. I never get sick. I just have 5 autoimmunes. Well, that's quite classic. The patient who also says, I have no medical problems, but then has a list of 5 medications. That's so funny. But, you know, to answer your question you asked me offline, for me, I have medical practice and everything's fine. I was practicing. Everything was great. Everything's wonderful, doing all the things. And then my wife got sick. She developed PMLE, polymorphous light eruption, which she had before I met her, and we just accommodated. We're like, okay, there's nothing you can do about it. For the audience that doesn't know, it's basically an allergy to the sun. And we're like, okay, it is what it is, nothing we could do. But then she developed her second autoimmune, which was psoriasis.
wow.
And of course, this was also pre-internet the way it was now. And so we went everywhere, and it was just heavy stairs, and just like, we just didn't go out in the sun. But it was like her psoriasis got so bad, like she couldn't button her clothes, she couldn't open things. It was really bad. So then we went into the land of the quacks, functional medicine. I had never heard of it. And this crazy person had the audacity to suggest that her diet was off. She's a size 0 athlete, healthy. If for those of you listening and not watching, it's air quotes, healthy, right? Did everything perfectly. But guess what? In her case, because it's not a one size fits all, in her case, she was vegan at the time. And she developed a severe response to corn and soy, which was basically her entire diet. Once we realized that, we removed corn, soy, gluten, and completely reversed. Psoriasis gone, PMLE gone. And I was like, what is this wizardry? And then you know how it starts. You take one class, you take another class, and before you know it, like I really cannot practice conventional medicine anymore.
You've got your mouth to a fire hose and you're just going with it, right?
Okay,
It's like this 10-year process. I mean, and that part for me, it's so exciting because you know that you're learning something so critically important. And when my husband, when we recovered him, and in that process of me learning what we were doing for that, I realized I completely cannot go to work on Monday morning and not do this every single moment of every single day.
Yes.
Because that's like, wouldn't even line up with my heart. There's just no way.
But it's hard because your patients aren't ready for it. And the system isn't ready for it.
Oh, right.
And you can't possibly spend the right amount of time through an insurance-based system that your patients actually need.
No, we tried.
I try too. You can't. You need an hour.
Yes.
You need an hour. Like what's in your cupboard and what's in your way and what do you do and how do you move and how do you sleep and how do you go to the bathroom? Like it's not possible.
Right, because everybody is bio unique. Like my husband's case of MS was these 4 things, right? Mold and Lyme and mercury and trauma. I do think almost everybody has trauma, but like not everybody has mold, Lyme, or mercury. Maybe someone else has a different series of
Correct.
noxious and immune stimulating or immune disrupting conditions or toxins or microbiome imbalances. So in order to figure that out, you really have to you have to know your patient on all the levels to really understand that. And I
Yeah.
found that out pretty quick. It was
And it
really
takes time.
painful.
It really is painful. Okay, so hubby gets sick. You have this aha moment. You try to bring it to your practice. You can't. But now you do something rather unusual. Tell us what it is, and then walk us how we got from hubby being sick to what it is that you do now.
I mean, now I consider myself an integrative, energetic medicine physician. And
Right.
of course, I incorporate my conventional medicine teachings and my functional medicine teachings. But I think that my medicine has evolved with my experience. And that's something that I'm very grateful for, because every encounter that I have is a teaching experience. And my husband, we actually went to a naturopath pretty early on in his care, because even functional medicine back there, this was in the 2000s, it wasn't like he just needed a few vitamins. And this was a long time ago. Functional medicine's evolved quite a bit since then. So,
Yes.
but I learned about homeopathy in that environment, and I learned about how to assess the body directly. So in our practice, we do something called autonomic response testing, where we test the body directly. It's a yes or a no kind of questions, answers through the body using the frequency of light. For example, if someone might have a condition with Lyme, if we broadcast, meaning magnify the light of Lyme in the room using a slide, that person's nervous system is continuously assessing its environment. So if someone toxic walks in the room, sensitive people know this. You can just feel it right away. You know something's off. It's no different if someone's got Lyme disease and you put the frequency of Lyme in the room. Their nervous system will tell you, no, thank you. Like, that's a stressful thing.
We've had enough of that. Thank you.
Yeah. So we use that type of testing to understand the unique recipe for the patient and what is truly underneath what's causing their conditions and their illnesses. And that takes us pretty far as recovery goes, because then we also use that response to identify the homeopathics and the herbs and the nutrients and the detox remedies. And I'm really grateful for it, because in the beginning, when I did functional medicine, I was really attached to the testing. But then when I found out the testing is only as good as the testing is good, it was like,
it's so true. Let me just re-say what you said for our audience, because you're so right. I think a lot of practitioners, when we first start out, and what I think the audience has to appreciate is that when you go down the functional integrated road, you have to figure things out on your own. You can't go to 7-year school for it. Like, you have to kind of figure things out on your own. So when you first start, I used to do the same with you. I used to be very heavy on testing, because like, how do you figure it out? How do you figure it out? What do you like? What's going on? What's happening? So what you're saying is that over time, you've discovered this tool, this energetic tool, and you're saying that it helps you in two ways. It helps you on first kind of, I'm going to say diagnose in air quotes, but what you're really looking for is what is the underlying thing for this patient that's causing inflammation, right? My audience is very well versed in inflammation. They know that inflammation is happening. But to your point, one person could be mercury, one person could be Lyme, like what's happening that's causing it. And then it sounds like then you do homeopathic intervention, and then you recheck again to see if it's working using that same test, which I love. I don't do energetic work. What I do, I stopped seeing patients altogether, but I heavily rely on the narrative, on the story. I go deep into the story. And then I use the patient's own symptoms, reported symptoms, to track every month which intervention worked. And I only do testing like maybe months down the road if I hit a wall and I'm like, I can't figure this out. So maybe now's the time for mold. Maybe it's not. But we all have to come up with it, right? Because you can't just test everyone.
No, I mean, you could drain their bank account in a heartbeat. None of these tests are usually covered by insurance. And so I feel like it's efficient in the sense, and the more that I do what we do, the fewer tests that we order. I think that's true for most physicians.
Exactly right. And so you only work with pediatrics?
No. So what happened was, once I started doing this type of medicine, my parents in my practice, for the kids that I was caring for, a few of them were having health issues, and it was pretty significant. It was clear that they weren't getting the help that they needed through the conventional lens. And so I started seeing it through the adults. And then once I certified in functional medicine, which I actually did before I saw it in adults, I started to transition into seeing the parents in my practice. Because I also realized that when you heal and work with healing, and by the way, I don't heal, the patients heal themselves. So I just want to clarify that. So I use that as a verb. But like when the patient's healing and the mother heals or the father heals, it's the child heals. I mean, it's like we're so connected. And the younger the child is, the more really clear that is to me. So also at some point, I thought it was very important for me to start seeing the patient's parents in my practice, and now grandparents, and then cousins.
Love this. Oh my God, I love this.
Yeah,
But you're right. Like, how do we heal a child if the parents are not healed?
exactly. Because their
How?
nervous systems are co-regulating 24 hours a day most of the time. And if mom's has a stress response that's under with some issues, then the child will have a stress response.
Oh my God, it's so clear now that you say. On a much more simplistic level, in my primary care practice, sometimes we see children who are battling obesity or prediabetes, and the parents are clearly also battling this, and they're looked at child like, I told you, Timmy, stop eating that. And I will tell the parents, like, how is Timmy supposed to stop eating that if you're bringing it into the house, right? That seems so clear.
Yeah.
That it has to be the whole, and I coach them like the whole family has to change. But to think of it energetically, the way you just presented it is like, it's like a whole different level. It's just,
Yes.
it's amazing. So, okay. So here's the thing. You clearly went off the deep end. You're absolutely crazy. And it's just why I absolutely adore you. So you became a medical disruptor. And I know this story. I've lived this story, and I hear this story over, and it's a really hard one. I want like our listeners to appreciate it. It's so hard to let go of something that you spent years doing, spent thousands of dollars learning, and the letting go is a process.
Yes.
But what was the biggest challenge for you once you just said, that's it, I'm a disruptor?
Yes. I mean, there was a blip of the challenge was that I lost my social community because I was very integrated, of course, good friends with all my partners and in my practice. And that was really clear that I was no longer going to be allowed to be part of that community because I wasn't following in their footsteps, which actually really surprised me. I wasn't expecting.
Did that surprise you?
When I first came in, it was like, look what I learned. I learned about Roundup and look at this.
No, you're crazy.
I was crazy. They said I was crazy.
You're crazy.
And this was a long time ago, but I remember them sitting me down at the table and they said, look, a lot of our patients are constipated. This was in pediatrics. And you have been recommending this thing called a probiotic. And we don't do that. We use Miralax, which
Oh God.
is antifreeze in a long call.
Oh my goodness gracious.
And you need to practice with under our tent, which was like how we practice. And if you're going to do these other things, then it's not going to work out. And I basically at that meeting said, I'll see you later, because there's no way that I'm going to go backwards, knowing what I know and saying this patient's constipation is not only better, but we're like, so this was 15 years ago. To be fair, probiotics weren't really well understood.
Oh, probiotics wasn't even a word. Like, what were you 15 years ago? No, clearly they have a Miralax. They have a Miralax deficiency, clearly.
Yeah.
Yeah. Oh my God, that's crazy. You know, it's funny.
That was more of a personal journey for me in terms of really bringing me to focus on like, what is important to me? Why do I do what I do? I don't do what I do to have friends. I mean, that's just really true. I do what I do to reach the goal that I have of supporting patients in healing themselves. So that I just kind of just had to move through. And there was a grieving process, but
wow.
Yeah.
I'm glad you speak of that. I don't think I've spoken that much with other medical disruptors about that piece, because it's real. You know, sometimes our patients look at us when we're already these fully formed disruptors, but the process it's painful and it's scary. Like, I remember when I first started on social media, I was terrified to speak my truth. So I would just talk about like very benign things like hydration and sleep. And I had to get comfortable with the fact that I'm going to get called out. And I've been called a quack like so many times, but it's a process, and you have to be willing to kind of face some ridicule.
Yeah.
But it's like once you swallow the blue pill, right? Once you drink the Kool-Aid.
And it's not like I've swallowed this blue pill and my patients aren't having good outcomes. What was
That's
happening
it.
was, from all other lenses, miracles were happening. Diseases
Yes.
were dissolving, and
Yes.
like autism was reversed in cases, and my husband's MS was reversed, and
Yes.
chronic conditions of bowel disorders were resolved. And so I'm seeing that in my room and with my patients and experiencing this incredible change in the outcomes of my patients. And then I'm going to these boardroom meetings and it's like,
It's so
what?
hard.
The reputation in the community. And this is what people wanted. We had 2,000 families at one point on our wait list because this is what they want. But it was so fascinating to me that didn't really like there wasn't a curiosity in the old structure. And I just kind of think of it as just a dinosaur mentality. And it's just like, I needed to leave it. And also when I left it, I realized how suppressive it was just in my, like Jen said, how you were worried about what you were going to say. And in the beginning, like, it's like, yeah, actually it was kind of the puppet master was trying to think about how do I word this and how do I do this where I'm like not totally out of the closet on this topic. But at some point, you got to let it go. And because it was slowing me down, I think of it as like a bird wanting to fly, but they're tethered by a string to the earth. And you're like, now just cut the string, man. See you later.
Yeah, cut the string. I mean, now I'm sure your answer is very different than it was maybe a few years ago. What do you do when people push back or criticize or comment?
I mean, honestly, I don't really get that much. I think
Yeah.
because, once you find also your community
Yes.
and
Yes.
the people who I'm not for everyone, not everybody wants
Correct.
a deep dive into their body and like really understanding the trauma response and like moving through something like that. And that's okay. And I'm okay with that too. I think there are different patients for different physicians.
Yes.
So I don't really encounter it much because I'm matching up and syncing with the people who are like-minded, basically.
Yes, that is so true. There's a point where you like fear and deal with it, and then you like overcome the threshold, and you're like, oh, I'm just around with my people all the time, and it
Yes.
doesn't even matter. I
It's
almost
so
feel
fun.
sorry for you that you don't see the light.
Yeah, yeah, because it's so it's not in my environment anymore. And now it's like we're co-creating this medicine that's like really powerful. And I'm passionate about what I do. I could literally work all the time, except that I don't.
I'm with you on that, sis. Work all the time.
Yeah, but I love it. So that's part of the piece. And I think the other part that was hard with this transition was probably just building the system that I could work in. Because like you said, it wasn't like I have a medical school that I can go to, or I had to really search out my training and move with where I was pulled to learn these different skills. Because I started with the autonomic testing and then I moved into frequency medicine using like TENS unit devices where you can support the body with frequencies, which was another incredible leap in my practice. We could treat fractures or head injuries in a way that I never could imagine.
Amazing.
And then I moved into body work where I learned cranial sacral therapies and visceral osteopathic techniques and really hands-on medicine, which has deepened the ability to move the trauma out of tissue, which I think is really root cause of a lot of our patients' conditions. So I'm a lifelong learner.
Yeah, you have to be.
And I'm a yes girl. If it sounds right.
Yeah, let's try it. Let's try it.
Life's too short.
It's so funny because that's what they intended when in med school and P school, PA school, they're like, get your CEs, right? Like be a lifelong learner. But you and I know those CEs is not that. What we're doing, constantly rethinking and reshaping how we're practicing, going back to the drawing board, getting a brand new complex patient that nothing works for, that you've learned that so far, and saying, no, I'm not giving up on you. And trying to look for new modalities until you solve it. That's lifelong learning. Not getting 120 Cs.
It's fun and it's a challenge. I call myself the ND medical detective, right?
Love.
It's like, that's what we're doing. We're like, okay, and we have a new world. So guess what? We have new bodies and new patients and new conditions that I can't go to the 100-year-old textbook and look it up and get really any information at this point. I mean,
Yes.
I sucked that world dry a long time ago.
Do you
Yeah, I
only work?
also think that the focus for me at the beginning, where the young newbie doctor was, we're so focused on illness. Like everything is about categorizing the illness, right?
That's all it
And
is.
my focus right now is on recovery and like, what does recovery look like? I realize that I've been kind of fooled in the past, a long way back when, that where the body was viewed as doing something wrong. Like if you have constipation or something like that, it's like the problem is in the body. Actually, the problem probably, I know this, the problem is not in the body. The problem is in the stress response in the nervous system. But that stress response is happening to protect that patient from something that has happened. And even if it's outdated, then we just need to re-educate the body to get it to align with what's happening. Or like thyroid, for example, like if somebody's low thyroid, and not the autoimmune type, but the resistant type, their body's doing that on purpose because they have such a stress level that they can't have high metabolism. Like it's trying to protect itself in some way. So understanding that and then working with what the real drivers are, I think has been a great shift.
I love that. Do you only work with patients in California?
No, I have patients all over.
Do they have to come to you, or do you?
Tend to be in person because I'm an in-person, like I'm a hands-on doctor. So my patients that live in other states, they usually see me a couple times a year. In the very beginning, they might see me more frequently than 1 to 2 times a year in person. But I think that I would love to say that I could do this tele, but I'm not at that level.
It doesn't sound like energy work could be done tele.
Yeah, it might be able to be, but I'm not at that level.
Yeah, at that level. I mean, you're right. I could do tele because for me, it's really the narrative, hearing it, asking.
Yes.
For you, your modality really sounds like it needs to be in person, which is what it is. What else do you want to tell our listeners that maybe I forgot to ask?
What do I want to say? I think probably one of the things that I think I just spoke to it, which is that misunderstanding of like the body's natural state is wellness. And it's a genius situation. Okay, this is genius. And everything is linked and related together in a very intimate way. And I'm realizing like the body's very sensitive. It can sense its environment. It can sense literally the intention of my hand before I even touch it. I can see how something will shift in the body. It's really wild, but the more you understand that. So in that journey, we have this mentality of like, kill it, get rid of it.
Yes.
Change it. But I want to say that it's really, can we align with it? Can we witness it? Can we see it? And then can we move together? Like,
love that.
That's a big frame shift that's developed for me over the years of realizing, oh, wow, the body is not the enemy. And if we could get to a place of appreciating the body, witnessing the body, and then maybe hopefully even having gratitude for how it's handled the stressors that it's experiencing, that's when real miracles start to happen.
Oh my God, that is so good. I have to just say one more thing before I ask you how people can find you, is just because you said the word wellness, and it just hit me how absurd it is that the insurance companies call these annual visits wellness visits. When it's such a misnomer. It's like, it's not a wellness visit. It's let's check if there's any illness. It's a lack of illness visit at best.
Yes. That's so true.
Right? Let's just, oh, you don't have this, you don't have this, you don't have this. Oh, you're good. I'll see you next year. That is not wellness, right?
No,
it's not wellness at all.
I know. I really appreciate that. I think functional medicine really understands that like lack of illness is not wellness.
Lack of illness is not wellness. My God, I should get a t-shirt that says that. Yes. Lack of illness is just not wellness. So how do people find you?
I think probably my website is the best way to go.
We'll link it, but tell us anyway.
What it is, or?
Yeah. What your website is.
Oh gosh, I actually don't even know if I know it.
Wait,
it's like ollyhealthinc.com, I think.
It's Ollie Health. It's ollyhealthinc.com.
Yeah, OLLIE, ollyhealthinc.com. Oh, we have a whole team.
Don't worry, we'll link it.
Yeah, we have a whole team of people, which is the other thing I guess it would say is that I've realized that it's a team approach because having someone who can help support a patient with their trauma or their somatic experiencing, having that functional dietitian, having the visceral therapist or the biofeedback therapist or whatever that is, and the providers, like
Yeah.
it's pretty amazing what you can do when you bring in all of those pieces together and it really moves the needle because I can only move the needle so much with supplement or with my body work. But if they also are working with a therapist and working with the trauma in the body, it's fireworks.
Wow. I love that. Okay, everyone, this has just been amazing. I can't thank you enough for being here. You really brought another dimension to our space, and even just that personal piece of what it's like for the provider. I don't think we ever discussed that before. Thank you for being here.
Thank you for having me.
Of course.